Hi everyone, welcome back. Today we're joined by Dr. Sean Esplin, a high-risk OB, who's going to talk to us about how our hospitals are still a safe place to come. We understand that delivering a baby during this time can be extremely stressful, but we want to reassure you that giving birth at our hospitals is safe. Sean, thank you so much for joining us. We really appreciate it.
Well, thank you for having me. I'm excited to talk to you.
Yeah, so our visitor policies, our new ones, are going into place tomorrow, effective as of 7 a.m. And those visitor policies have changed a little bit for laboring patients. They have been reduced to one visitor throughout the stay of their hospitalization. It's for the safety of not only them, but the patients and the community around us. So this kind of topic was super important to bring up right now, especially. So do you want to talk a little bit about why those restrictions were put into place and what the benefit is for not only the mom, but everyone else around us to reduce the risk of how many people come in?
Absolutely. So anything we do, any change we make or any policy we have is 100% for safety and for mom, babies, visitors, and for our staff. So limiting the number of visitors to come to labor and delivery is meant to make sure that we're preventing the possible spread of the coronavirus. So fewer people means fewer opportunities for someone to be exposed. And at this time, we're kind of trying to find the sweet spot between making sure that we're having a great experience with the delivery, but also being safe. And right now, that spot is having one visitor there that can provide support. Our staff is actually really experienced and awesome at helping too. In fact, I can think back on for our own deliveries that we've had, my wife and I, and those nurses and physicians actually were a big part of our deliveries, and we'll continue to do that. We know how to provide the support, and we know how to make people feel comfortable and to help them. So the whole purpose of this is for safety.
Yeah, I think that's really important to know that your nurses and doctors that are working with you for your delivery are also support people. They may not be the person that you would have chosen to be there, but those people are going to help you and support you as much as they can. So my first question to you is, should I be worried about delivering my baby in the hospital right now?
Well, this is a scary time, and I think people are scared because they don't know what to expect. And I can reassure everyone that we've gone to great lengths to make sure that it's safe to come to the hospital and have your baby. In fact, I would say that the hospital where we're taking extra precautions is actually one of the safest places to have your baby. We're not experiencing some of the things that people might be seeing in the media right now, things that would be scary, but what we are preparing and trying to prevent that. I think we've seen the effect of our social distancing actually kind of slowing things here a little bit, which is good, but we need to continue that. And actually, if we can be better at that, it's going to make it even safer. But right now, we're doing a lot of preparation and making sure that it's going to be safe at our hospital.
And what can I do myself to prepare for this very unique delivery experience that I'm going to be getting?
So a couple things. Number one, stay in contact with your physician. Make sure that you're following the recommendations that she's giving or she or he are giving to you. So phone visits or the face visits are actually things that you need to keep doing. Also talking to them about what to expect when it's time to come to the hospital. Right now, the best thing you can do is to keep yourself safe by staying at home as much as possible and not being exposed to people who might already have the coronavirus and might spread it to you. So keeping yourself at home is probably one of the most important things that you can do. Go ahead.
I was just going to ask about the visits. So I know that mothers have visits that they're supposed to do every couple of weeks with their doctor. You talked a little bit about the telehealth portion of that. Are we still continuing those normal appointments? Are they in person, or are we asking people to do those over the phone?
So one of the things that we've done is actually adjust the number of visits that we're actually having in person with patients, and that's to limit the times that people have to come out of their home and have the potential of being exposed to other people. So there are certain visits that need to happen face to face, and those are times when we're maybe drawing labs or checking blood pressures or doing ultrasounds. Those things have to happen in the hospital, but most prenatal care doesn't necessarily have to happen in the hospital. So it's safe to do some of these visits over the phone or with a telehealth option, and that's something that we're utilizing now and finding that we can keep that connection with our patients. We can make sure that we're giving them information and asking them about symptoms or problems that might be coming up, and limit the number of times that they have to come to the hospital.
And if you have a high-risk pregnancy too, does that change at all in terms of getting more in-person care? Does it depend on the situation as well, or what are your suggestions for that?
That's a great question. So it turns out that it really depends on what's making you high risk, and that's a conversation to have with your doctor. If you have a complication like diabetes or high blood pressure or some other problem that's going on, it might require you to have more in-person visits.
That makes a lot of sense. So do I need to deliver early if I have COVID-19 or if I'm suspected to have COVID-19?
So it turns out that COVID-19 by itself is not an indication for delivery. The women that have had COVID in our state and are pregnant, we're just kind of watching them and making sure they don't have symptoms that require them to be in the hospital. It's possible that someone might have COVID and can stay at home and just monitor themselves for symptoms. So COVID-19 by itself is not an indication for delivery. And we're not encouraging people to come in and try to deliver early or to change their delivery plans because of the COVID-19.
My next question was going to be about delivery plans. We've seen a lot about people looking to switch to home births as opposed to coming into the hospitals. If you had the plan of coming into the hospital and giving birth there, should you be sticking to that plan, or should you think about changing your birth plan?
So I can understand why I understand why people would want to deliver at home, and I actually feel like we can provide a lot of the same advantages that people are looking for at home in the hospital in an environment that actually is prepared for any complication. So I actually think that if you were planning on delivering in the hospital, you should continue that and talk to your doctor about any concerns or worries that you might have, and be reassured that we're doing everything we can to make it as safe as possible. The thing about this is I think fear comes from not knowing or not being prepared. And the fact that we're preparing and we're giving information, I think, should alleviate fear and make it so that people can be comfortable when they come here and understand that we're going to help them, part of the team with them, to help them have the kind of experience that they want in the safest possible environment. So, I mean, there's a give and take here. There are some complications that happen just because you're pregnant, and some complications that might happen because you have COVID. And both of those problems are best dealt with in the hospital.
If you are feeling sick at all during your pregnancy too, how do you protect your newborn child?
That's a great question. So first of all, if you have symptoms, it's important for you to call your doctor and go and be tested if you should be. You need simple precautions like making sure that you're wearing a mask and making sure that you're wearing appropriate protective equipment will protect your baby. Unfortunately, the good news is we don't know that COVID is passed from a pregnant mother to the baby while the baby is still in the uterus. But after delivery, there's a potential for exposure right in those first few hours after delivery. And we're trying to really protect babies in that situation. So the best way to do that actually is to keep someone that we know has COVID and their baby separated by distance so that the virus isn't passed to the baby in that time. There are some other precautions that people can take, and that includes wearing a face mask, wearing a gown and gloves, and washing hands, and preventing direct kind of droplet contact. So when we breathe or when we sneeze or cough, little droplets with the virus can be emitted into the air and can then cause infection to other people that are close by. So being distant and having barriers is actually the way to prevent it.
Another question that we've gotten asked is about breastfeeding, and if that COVID-19 has an impact on that at all, or what suggestions are for that. Do you have any thoughts on what expecting mothers can expect to get recommendations from their doctor?
Absolutely. So we are big proponents of breastfeeding. We think that's great. And one of our goals is to help people be successful with breastfeeding. And so we teach them how to do that. And we want that to happen. The breastfeeding is not contraindicated in women who have COVID. We haven't found the virus in breast milk. And so the act of breastfeeding shouldn't be a problem. But the baby can be exposed when they're on the breast. So the optimal would be to pump and then have a non-infected person feed the baby through a bottle at first. But if we're going to breastfeed, really cleaning the breast and the nipple before and after the feedings, and making sure that you're wearing a mask and gown in an appropriate way is the way to protect the baby.
And I'm sure your nurse or your OB could talk to you specifically about what the best plan is for you too.
Exactly right. I mean, that's another reason why it's awesome to be here, is because we will help support you in that, and we'll help you to learn how to do it so that you're comfortable.
That's awesome. Is there anything else you kind of wanted to tell people today about giving birth at the hospital, or that our hospitals are safe at all right now?
I think basically just reminding people that we're part of the same team, and we want to, when I think about what I hope will happen for patients, is that number one, that they have a safe delivery for them, their baby, and the people that are taking care of them. And the number two thing on my list of things I hope happens is that it happens the way that they want it. Mm-hmm. And so we're trying to meet both of those goals here. And if we are making a suggestion or a change, it's because we want to make sure that people are safe. And I think we can actually do really a great job of making it safe and making it comfortable and a good experience for everybody. This is also a time where, it's super exciting I'm a grandpa, and I love seeing my granddaughter, but and I can understand how it would be difficult for extended family to not be there. Mm-hmm. But it's so important at this time to keep everybody safe by making sure that we're not in too close of contact. But that physical contact we're limiting, but being together socially, at least through electronic means, so FaceTiming or through other over the phone, that we would encourage, and we encourage that as well while the patients are in the hospital.
One last question for you, actually. So if you just gave birth to someone, you're sent home, you're discharged from the hospital, do you have any recommendations on when people can come over? Right now, I know we're not supposed to be interacting with extended family if they don't live with us. I'm assuming that's the same way for a newborn, that you want to limit the amount of people that are coming over.
It's actually probably more important when you have a newborn there to follow those guidelines. And so I would limit it to the people that live in the home as much as possible, and do other visits virtually. That's probably the best thing to do.
Great. Well, thank you so much for joining us today. We really appreciate it. And if you guys have any questions about COVID-19, you can contact our COVID-19 hotline at 844-442-5224. We also just launched our emotional relief health hotline yesterday, and that phone number is 833-442-2211. It's available 7 days a week from 10 a.m. to 10 p.m. Thank you guys so much for joining us. We'll talk to you next time.